time. सो लास्ट टाइम मेरी गलती थी, मैं टोटली भूल गई कि डॉक्टर के साथ मेरा पॉडकास्ट है लिपोसक्शन को लेके एंड वो वेट करते रहे और पता नहीं इस पॉडकास्ट का मुहूर्त ही नहीं निकल रहा है. सो वंस मोर आई ब्रिंग डॉक्टर आमोद राव और कॉस्मेटिक सर्जन, एस्थेटिक सर्जन है और वो हमें सुंदर बनाने का काम करते हैं. सो वेलकम बैक डॉक्टर आमोद.
Thank
थैंक यू सो
you.
मच.
Thank you so much.
So
Thank you so much
when
for
you
having me again.
my pleasure completely. So when you say aesthetic surgeon and cosmetic surgeon, what is the difference?
Aesthetic is the more refined term. It's usually a plastic surgeon is called an aesthetic surgeon, and a non.
Oh,
Yeah, so that's what the nomenclature is. So people
okay.
say if you're a plastic surgeon and you're doing cosmetic surgery, then you're an aesthetic surgeon, and then if you're any other surgeon, then you're a cosmetic surgeon. So
Oh,
that's just that. It's cosmetic surgeon is also fine. It just sounds
mm,
better. A. That's
yeah,
right.
it sounds aesthetic, I would
Yeah,
say.
aesthetic.
ऑल
Yeah,
राइट. सो लास्ट टाइम हमने बात की थी ब्रेस्ट रिडक्शन की, वहां पर भी
correct.
रिडक्शन की बात हो रही थी और यहाँ पर भी लिपोसक्शन या टमी
Fat
टक्स
fat reduction.
या हाँ फैट रिडक्शन वगैरह. सो मैंने सुना है कि अदनान सामी ऐसे ही मेहनत करके पतले नहीं हुए और उन्होंने मतलब फैट रिडक्शन एंड वो सब
See,
करवाया है.
I don't know what Adnan Sami has done or per se by himself. I mean, उनके ऊपर क्या किया, I do not know. But a person who has that amount of weight, liposuction and tummy tuck is not the surgery for weight reduction. So liposuction and tummy tucks are surgeries meant for body shaping procedures. They are
ओ,
not they are not weight reduction procedures. So anybody
ओके.
like probably Adnan Sami would want to lose weight. I don't know. Again, I comment. I don't know what he's done, but anyone of that weight who's morbidly obese should go for a bariatric surgery, not a liposuction. Liposuction is the wrong choice. It's not the
ओके.
choice. Yes.
Okay, nay, I don't know what he's done. I'm not saying that I
Yeah.
know. I don't know what he's done. I just know कि वो he was obese and then suddenly he was thin.
Yes.
And from
Yes.
somebody who has seen him, apparently he has a lot of cuts and marks of stitches
So
all over his body.
yeah. तो क्या हुआ होगा वॉट एवर वेट रिडक्शन ही इज डन जैसे भी किया हो उन्होंने समझो कि डाइटिंग किया हो या एक्सरसाइज के
Mm.
साथ या बेरियाट्रिक सर्जरी के साथ वेट रिडक्शन के बाद क्या हो जाता है इन मॉर्बिड ओबिसिटी के लोगों में उनकी
Sag,
स्किन लटकने लगता है इट्स
sag
लाइक
होने लग.
सैग होने लगता है उसके बाद टमी टक करते हैं वो काम मेरा है वो काम मैं करूँ
Ah,
सो देन दो
okay.
स्टिचेस आर फ्रॉम द पोस्ट वेट लॉस बॉडी शेपिंग प्रोसीजर
ओके, ओके, ओके.
यस
लेकिन ये
यस
स्टिचेस के निशान हमेशा रह जाते हैं क्या? ऐसा नहीं है कि वो
कोई
डिसअपीयर
कट
हो जाएँ?
शरीर में नहीं कोई
योर
कट
वॉइस इज़ गॉन.
सर्जरी
हेलो?
कोई कोई कट अगर बॉडी में आ जाए कैन यू हियर मी नाउ
या आई कैन हाँ.
any cut in the body will heal with a scar. It doesn't go heal completely. But how well a scar heals is the question. नाउ क्या हो जाता है लोग लोग क्या कहते हैं अरे तुम्हारा सर्जरी इतना बेकार हुआ है तुम्हारा स्कार देखो कितना बेकार सर्जन ने दिया है सर्जन
हाँ,
स्कार नहीं देता है आपके
हाँ.
खुद का बॉडी विल हील इन दैट वे इसलिए आपको स्कार
ओह!
ऐसे हुआ है लोग समझते
ओह,
नहीं है
इसलिए.
कि कहते हैं सो योर हीलिंग इज डिफरेंट माई हीलिंग इज डिफरेंट सम अदर पर्सन
एवरीथिंग इज़
हीलिंग इज
डिफरेंट.
डिफरेंट so it is like that
हाँ.
how your body heals they say keloid scar गोरे लोगों में बहुत कम होता है मैंने ये हाइपोट्रोफी कीलॉइड स्कार आई हैव सीन इट इन अ फेयर गर्ल इतना
व्हाट
ज्यादा
इज़ अ
थिक स्कार
कीलॉइड?
शी इज गॉट एंड ओवर ग्रोथ ऑफ टिश्यू ऑफ स्कार
हुँ,
टिश्यू यूजली वो
हाँ.
कान पे आता है या छाती पे आता है इट ग्रोज बिग एंड
ओह!
जो कट के बाउंड्रीज के बाहर भी हीलिंग टिश्यू उगने लगता है तो दैट इज अ कीलॉइड
ओह! ओके, ओके,
और
ओके.
हाइपोट्रोफिक स्कार वो जो जाड़ा हो जाता है ना स्कार
हाँ, हाँ,
दैट इज
हाँ.
कॉल्ड हाइपोट्रोफिक स्कार नाउ दैट कैन हैपन बिकॉज समझो आप जॉइंट के ऊपर कट लाए यू हैव अ
हाँ.
कट तो
हुँ.
क्योंकि देयर इज कंटिन्यूअस मूवमेंट तो वो फोर्सेस रहते हैं, तो वो जो अगर अच्छी तरह से टाका लगा के रखें तो वो खींच जाता है, और वो जो हीलिंग टिश्यू बनता है वो स्ट्रेच होता है, इसलिए यू गेट अ
अच्छा।
थिकर स्कार. So that is, it is how your body is. It's not how the surgeon has done. Of course, अगर आपको गनी सैक की तरह सिलाया गया हो तो फिर जैसे कि गवर्नमेंट हॉस्पिटल्स में कभी कभी, आई शुड नॉट बी सेइंग दिस बट इट इज अ फैक्ट, मामा लोग विल कम एंड स्टिच यू अप. तो वो लोग ऐसे
Yeah.
सुई धागा लेके काट 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 मार देते हैं. दे डू अ
Yeah.
गुड जॉब बट दे डू अ बैड जॉब ऑल्सो.
Yeah.
तो
Yeah.
ऐसे भी होता है.
So, do you really think that liposuction or fat reduction, by cutting and chopping the body, is the right way to go about it?
तो ऐसे होता है ना, some people, that's the whole thing. You'll always see a slim person or
Huh.
a person who is not, doesn't have too much weight, who's responded to exercise, will say, "Arey, if I can do it, they can do it." No, it's wrong. Yes, the point is correct that yes, you should have the motivation to do exercise and diet. That is the best way to lose weight. But there are many people जो exercise करेंगे, diet करेंगे, they do not lose the weight. तो वो लोग क्या
हाँ,
करेंगे?
हाँ,
वो क्या कर सकते हैं?
क्या?
What would they do? So then they have to come for either, if it they're obese, देखो एक बार if a person crosses say 100 kilos, तो उनका
हुँ।
वजन इतना है कि वो एक्सरसाइज ही दे विल नॉट बी एबल टू डू, क्योंकि उनके घुटनों में दर्द होगा, उनके पीठ पे दर्द होगा.
सॉरी।
तो एक्सरसाइज कैसे करेंगे वो?
हुँ,
भागना पड़ेगा, दौड़ नहीं पाएंगे. तो देन यू डू अ बेरियाट्रिक. या कई होता है प्रेगनेंसी के बाद पेट विल हैंग डाउन, लटकने लगता है, वहां पे लूज स्किन है, एक्सरसाइज से स्किन कभी टाइट नहीं होता है. लोग कहते हैं
हाँ,
अरे
नहीं होता।
एक्सरसाइज करो स्किन टाइट हो जाएगा, नहीं होता है. To certain extent the fat will reduce, it will shrink, but अगर stretch marks हो तो it's not going to tighten up. Then you do a tummy
Yeah,
tuck. Then you have to
no,
do a
yeah,
tummy tuck. कई
हाँ,
लोगों में एक्सरसाइज करेंगे तो चेहरे पे वेट कम हो जाता है, या
हाँ,
कई लोगों का आर्म्स कम हो जाता है. कई कई लोगों का जितना भी एक्सरसाइज करेंगे वो हिप साइड, साइड हिप्स इज कॉल्ड सैडल बैग्स. सो
हाँ,
सैडल बैग वो जाता नहीं है. दे कांट डू
हाँ।
एनीथिंग एंड इट लुक्स
Is
वेरी
that
फनी
ce
लाइक दैट.
is that cellulite?
No, it's fat. It is
Oh,
fat
it's fat.
deposition, which is more permanent, more white fibrous fat. So you suck it out.
Okay.
Then you have to do a liposuction and suck it out and contour the body. कहीं कहीं
हाँ, so when
abnormal fat deposition होता है, तो looks so bad on clothes. So you're slim on top and you got a big side. It looks so
हुँ,
weird. क्या करेंगे?
yes,
Oh no, you do
yes.
leg exercises. Leg exercise करने से leg पतला होता नहीं है.
हाँ, नहीं
या
होता
या
है।
या या 3,000 या 10,000 क्रंचेस करके पेट कम नहीं होता है. वो सब बकवास है. लाइक जिम में जाओगे,
हाँ,
अरे और 10 क्रंच करो, पेट कम हो जाएगा. नहीं होता है. इट इज नॉट बिकॉज ऑफ द क्रंच, इट इज बिकॉज ऑफ द वर्कआउट यू आर डूइंग, आर लूजिंग वेट. It is not because you have done crunches you have lost weight. It is because of the cardiac activity of burning fat. So that reserve of fat is you are losing, so it will shrink.
so
और
I
कभी भी
have
अगर,
seen sorry,
sorry, go
continue.
ahead, go ahead.
No, I have
So
seen some people वो अचानक से वो बोलेंगे कि मैं पतली हो गई या पतला हो गया, लेकिन उनकी फैट बहुत लटक रही होती है, तो वो
correct. उसके लिए
लाइपोसक्शन करते हैं।
अगर स्किन लटक रहा है फैट के साथ तो फिर टमी टक, अगर पेट की जगह पे
हाँ,
या हाथ
हाथ,
अगर लटकता
पैर,
हो
हाँ,
तो you need a tuck. So arm tuck is called a brachioplasty. Or your thigh will hang loose is called a thigh tuck. You have a butt hanging loose, like a droopy butt, you do a butt lift. तो ये अलग अलग है जहाँ पे कट लगता है. अगर समझो
अच्छा,
कि फैट जमा हो, स्किन टाइट हो, फैट नहीं जा रहा है, तो देन यू डू लाइक लव हैंडल्स. कभी कभी
हाँ,
जाता नहीं है, कई कई
हाँ,
लड़कियों में पेट नहीं जाता है, जितना भी एक्सरसाइज करेंगे पेट नहीं जाता है. तो वो
हाँ,
पैंट पहनते हैं, ऊपर फ्लैट है, थोड़ा बल्ज रहता है नियर द बेल्ट एरिया. तो क्या करेंगे? दे कम गेट अ लाइपोसक्शन डन, दैट विल बिकम फ्लैट. एंड इट इज मच
हुँ,
सेफर देन यू टेकिंग. ये लोग क्या करते हैं, जाओ एक्सरसाइज करो, ठीक है, सही बात है, गलत नहीं है, एक्सरसाइज करो. वहां पे बोलेंगे कि जाके फैट बर्नर्स ले लो, दैट इज रॉन्ग.
अच्छा,
थायराइड पिल्स लेते हैं लोग टू बर्न फैट. तो
हाँ,
आप आपके मेटाबॉलिज्म, आई हैव सीन सो मच रबिश, यू हैव नो आइडिया. कैफीन टैबलेट्स, अरे हाउ मच ऑफ कैफीन, यू आर इंक्रीजिंग योर हार्ट रेट, यू आर
हुँ,
अफेक्टिंग योर होल सिस्टम. That is
People do
not, that
that?
is okay. Yeah, of course. Ephedrine, pseudo ephedrine, क्या क्या लेते हैं लोग?
अरे बाप रे!
They
But
they are all
these
anti-allergic,
pills,
antihistaminics, which increase your heart rate. Your metabolism will increase, but you are increasing your heart rate. You can end
is
up
there
with cardiac arrhythmias. You can end up with so many things.
is there any natural way to increase your metabolism?
No, exercising. See, if all your hormonal profile is fine, you
Mm,
exercise well, you go on a calorie deficit diet, you would lose weight. But in some people, even in that, they don't lose weight. There are some people, these new wonder drugs which have come out, or semi-glutide, or Ozempic, Monjaro, and all those things. They
mm,
work in some people, they work very well. In some people,
okay.
they don't work at all. क्यों? आपका body ऐसा है, they're not responding.
It
बस.
depends from body to body,
Yes,
basically.
yes, yes, very, very much.
Right. Does it have anything to do with the mental and emotional makeup of a person?
Always, mental, emotional makeup will always work for everything, no? That is the main seat of everything. Your aura
Right.
around you, your whole being is all how your mental, emotional state is. You,
Right.
if you get up in the morning creeping, you're going to have a bad day. That is for sure. You get up in the morning complaining, you are going to have a bad day.
Right.
So,
So,
yeah.
डॉक्टर, सपोजिंग किसी का वेट बहुत ज्यादा है, ठीक है,
Mm.
सालों साल से ज्यादा है, और फाइनली दे डिसाइडेड दैट ओके आई एम गोइंग टू गो इन फॉर लिपोसक्शन, और लिपोसक्शन किया, फेस भी साथ में सैग हुआ, तो उसका क्या करेंगे?
जिन्हें अगर कोई किसी अगर फिर से आई एम टेलिंग यू, अगर कोई मेरे पास आता है और कहेगा कि सालों साल से मेरा वेट कम नहीं हो रहा है, मैं लाइपोसक्शन नहीं करूंगा.
हाँ.
लाइपोसक्शन इज नॉट अ वेट रिडक्शन प्रोसीजर. इट इज अ
हम्म.
बॉडी शेपिंग प्रोसीजर. तो मैं
हम्म.
आई विल सेंड हिम और सेंड द पेशेंट्स टू माय फ्रेंड्स हु आर बेरियाट्रिक सर्जन्स.
ओके, एंड उसका कोई साइड इफेक्ट है लाइपोसक्शन का?
देर इज स्वेलिंग, देर इज कभी ब्लीडिंग हो सकता है. स्वेलिंग तो होगा, ब्लीडिंग होगा. कई कई
ओके.
लोगों में थोड़ा हीलिंग टाइम ज़्यादा होता है. कई लोगों में
हम्म.
अनइवननेस हो सकता है. सीरोमा हो सकता है. सेंसेशन लॉस इन दैट एरिया हो सकता है. इट कम्स बैक यूजुअली. वो
ओके.
सब लाइपोसक्शन, सब समझो मैंने पेट का लाइपोसक्शन किया. So some they feel there'll be a lot of swelling. Swelling increases for about a month and then it starts going down. तो आपको अजीब सा लगेगा, सेंसेशन अलग रहेगा. आपको कॉर्सेट पहनना पड़ेगा 6 वीक्स के लिए ताकि पानी ना
हम्म.
भरे. तो ऑल दोस
ओके.
थिंग्स आर देयर. इट टेक्स, बट मेहनत लगता है, बट यू विल बर्न द फैट. आई मीन ऑल द फैट इज आउट. और एक बार एक
बट
जगह से फैट निकाले जा, अगर यू टेक इट आउट, फिर से वापस उसी पे उस जगह पे नहीं आएगा वापस.
ओह! सो मतलब अगर आपने लिपोसक्शन करके उसको कर लिया, तो दोबारा
हाँ
वहाँ
तो
फैट नहीं भरेगा?
नहीं, नहीं तो ऐसा है कि एवरीवन इज बॉर्न विथ अ फिक्स नंबर ऑफ फैट सेल्स. दे आर कॉल्ड
ओह!
एडिपोसाइट्स. इनका साइज
ओके.
बढ़ता है या साइज कम होता है, उनका नंबर नहीं बढ़ता है. दे लाइक ग्रेप्स, अरेंज लाइक ग्रेप्स, येलो ग्रेप्स. तो ये साइज बढ़ता है या साइज कम होता है, साइज सॉरी नंबर नहीं बढ़ता है. तो अगर एक जगह से समझो हमने फैट सेल्स निकाले हो, then you do not follow a diet, you don't follow exercise, and there is you gain weight, the fat will get deposited in the next programmed position. Your body is programmed to deposit fat. तो
ओह!
मसल के पीछे जा सकता है, या बट में जा सकता है, या फेस में, या आर्म्स में. So each person is programmed where the fat will get deposited. In men, usually it is abdomen. In women, sometimes it's the bum, it's the breast, it can be the back, also the abdomen. So it depends.
Okay. And is there any kind of a right age to do these corrective surgeries or body shaping?
See, you have to see why they want to do it. It is not, some people are very sure of what they want. Some people do it for a fad. जो लोग फैड
Yeah,
के लिए करते
most
हैं,
of
तो
them do it for a
वी
fad.
डोंट डू इट. No, not most. Actually, now they're more aware. People are more aware, and surgery. They're very scared of surgery. So actually, people who come for surgery are motivated. क्योंकि liposuction is an elective procedure. It is not a necessity. तो जो
Hmm.
पेशेंट्स मेरे पास आते हैं, जो मेरे कंसल्टिंग रूम के अंदर आते हैं, दे आर नॉट माई पेशेंट्स, दे आर माई क्लाइंट्स.
Hmm.
They become my patients after I operate on them. They're not suffering from
Yeah.
anything.
Yeah,
After I
right.
operate, then they're sick. They get pain, they have all, then they become a patient.
Right.
Yes.
Okay. So, I understand when a man gets a tummy tuck or something, that's a different story. But when a
No,
woman,
tummy tuck is
uh,
mostly involved for women. So
acha, but
okay, now I'll tell you the
you,
difference between tummy tuck and liposuction.
okay.
Liposuction में सिर्फ fat is removed out. You put small holes in certain hidden areas where it's not
Hmm.
seen. We put in a fluid, so the fat cells are filled with that fluid. It contains some medication which will stop your bleeding, etc. Then we put in a cannula, a pipe, a 4
Hmm.
millimeter or a 3 millimeter cannula. जहाँ पे
Hmm.
साले there'll be some slits over there, openings.
Okay.
We fix
Hmm.
it to a negative suction pump. Now, when the suction and the movement of the cannula and the negative suction ruptures the fat cells, and the fat content comes into the cannula and it comes out. Now that
Okay.
is that. Then
Hmm.
the skin will shrink. In a tummy tuck, after we do a liposuction, we cut. Suppose you're doing for the stomach, you cut down near the bikini line. You will lift the skin off the muscle, pull it down, cut off the extra skin. It's like अगर आप मोटे हो और पतले हो जाओगे और आपका फेवरेट ड्रेस को पहनना हो तो क्या करोगे? आप दर्जी आई मीन यू गो टू अ टेलर, वो कपड़े को काटेगा ना, तो वैसे स्किन को काटेंगे. तो दिस दैट इज अ टमी टक.
Hmm. Right. So, nay, I what I wanted to ask is when a woman does a tummy tuck, I mean, she has her uterus, her navel, and her, the placenta. And supposing she wants to get pregnant again or
She
something
can
like
get.
that,
So the when we do
is
a
there
tummy
any
tuck,
difference between
yes,
a
yes,
man
yes.
doing it, a woman doing it? That's what
No,
I'm
no, no.
trying to ask.
So the area of where we cut is the same. We
Yeah.
go, so the layers of the abdomen are, there is skin, there is a layer of fat and some fascia, then there is muscle, then is your intestine. So we do not go below the muscle, we are above the muscle. तो यूट्रस इंटेस्टाइन को हाथ नहीं लगाते हम लोग, छूते भी नहीं है, दिखता भी नहीं है सर्जरी में. ये ऊपर से ही करते हैं. We just take care of the skin and that is it, and the fat. So there is no question of injuring the organs inside, and they can again have a baby and whatsoever is not a problem.
Oh, because I remember when I had gone to a doctor to ask that I want to get a tummy tuck done. I'm talking about like 10, 20 years back. And I mean, of course, after both my pregnancies, I had a sagging tummy, and
Hmm.
my skin was like this, absolutely
They are
as in
loose or wrinkled
very
up. So
loose, wrinkled
you
up.
need you need Hinduja.
Huh. So I went for a tummy tuck और उन्होंने बोला कि if you plan another baby then you should do
Hmm.
it after that because वो
Correct.
नाभि को कुछ ऊपर नीचे करना पड़ता है.
नहीं, नाभि को ऊपर नीचे करना पड़ता है, बात सही है. नहीं, नाभि को उसी जगह पे हम लोग फिक्स करते हैं, बट पूरा रिजल्ट चले जाएगा ना. टमी टक को पूरा फ्लैट स्टमक विल गिव यू. यू हैव अ
Hmm.
प्रेगनेंसी अगेन, अगेन योर स्किन विल एक्सपैंड, अगेन द होल रिजल्ट विल गो विद, एंड व्हाट इज द पॉइंट ऑफ
No,
डूइंग
that
इट?
is a different story. Here he was talking in terms of the placenta and the navel.
No, 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 no,
Basically, he was
no, no.
talking about
I
that.
no. So the navel is connected to the body. We take off the skin around the navel and we reposition the navel. So that is nothing. I don't
Ah,
know what he was talking about because I don't think anything happens.
acha. So yeah,
He
he
must
was
have he
talking
must
about
have meant something else. Yeah,
repositioning the
that
navel. Maybe
reposition.
he was
Yeah.
talking about.
Yes.
Okay. But then that
Twisting of
doesn't
the skin.
affect any body. I mean, not that I plan to get pregnancy. It was just a conversation that we were having, and he
No,
said that. So, hi
nothing
Jay.
happens.
Hi everybody. KS Crystal, fresh from a nap, and hi everybody. Heartthrob. Thank you so much. So, if you have any, nahi, zaruri nahi hai. I don't think so, Jay. Thank you so much. He's a aesthetic surgeon, and we are just plain and simple talking about liposuction and fat loss and things like that and tummy tuck and all. So जैसे tummy tuck होता है ऐसे
Hmm.
you are saying that thighs, arms and butts and everything is also done.
Hmm. Correct.
Okay. Okay.
It can be done.
And
We also use energy based devices like laser and ultrasound to tighten the skin from inside. तो जब फैट निकालते हैं, when we are burning the fat, we burn the fat, melt the fat, not burn it. We melt the fat with an energy-based device. So that causes excessive fibrosis, that is healing, which causes some amount of skin to contract. So certain
Okay.
patients might not require a tuck. If even if they have stretch marks, the liposuction with a razor might work for them.
Oh, fantastic. I think I should come and see you then.
You should.
My voice is echoing. Okay, definitely. I think my our next podcast we'll do in your clinic whenever you have the time.
Done.
So,
Sure.
and मेरा मैं अपना checkup भी करा लूंगी. So, roughly speaking, what is the difference in the cost between a liposuction with your energy devices or a liposuction with tummy tucks or cuts, tucks all over the
So
body or whatever?
docs, of course, will cost much more because surgical time is more and the work required is more. So that's going to cost more. So at least you
Okay.
30 to 40% more than a lipo than what you would do for a liposuction. Say for instance, I charge 1 lakh. Suppose the entire package for a lipo of only the stomach is say 1 lakh. Okay.
Okay.
So if I had to do a tummy tuck, it would be about 2 lakhs, double that. So
Okay.
that's what it is. Because the time is more, everything is more. Though that's not the prices,
Understood.
but yeah.
And how, supposing, just for example, hypothetically speaking, I get a tummy tuck done and I, with that energy, thing that you spoke about,
When you do an energy based device, you don't need a tummy tuck. Sorry,
uh,
when you
uh,
do when I use an energy
liposuction.
based device, yeah, you use it only with the liposuction. When I'm
Huh,
doing a
huh,
tummy tuck, I don't per se myself use an energy based device because
huh.
sometimes I feel that the vascularity, the blood supply to the skin can get compromised. So I don't
Hmm,
do that. And
huh.
anyway, you're pulling the skin and making it tight. So I don't see why we
Yeah.
have to use an energy based device.
Huh. So no, what I meant to ask is, supposing somebody, I
Does a
do
liposuction, yeah.
a liposuction with an energy based device,
Hmm.
fat thing. How long does that last if I don't take care of myself, as in diet, exercise, and all, and if I do take care of myself, does it
So
come back? How fast can it come
no, no,
back?
no. As I said, the fat doesn't come back once you take out from that area.
Huh.
See, if I take out the fat, whether you've done a liposuction or a tummy tuck, once I've taken a liposuction, your fat is out. So that area, the fat is not going to
Wow.
come. Now,
Wow. I'm
if
coming.
yeah, so if we do fat, take out fat in a certain area, then the skin, if I only do a liposuction and the skin is loose, the skin is going to shrivel. So a
Yeah.
young girl, say she's in her 30s, has had children, her skin is loose, she only opts for a liposuction, she will end up with loose skin. That loose
Yeah.
skin will look like a 70-year-old stomach. Also, in a tummy tuck, we also fix the abdominal muscles. Most girls after pregnancy have something called as a divarication of the rectus muscle. वो सिक्स पैक मसल जो है उनके बीच
Hmm.
में स्प्लिट हो जाता है प्रेगनेंसी की वजह से, फिर वो वापस नहीं आता है मिड लाइन पे, तो उसको हम टाइट कर
Oh.
लेते हैं.
Oh. अच्छा ये भी होता है.
हाँ हाँ.
अच्छा.
You can give a
Okay.
concave stomach, proper concave stomach.
Okay.
Yeah.
All right. And Jay is asking, can somebody with medical issues, example, asthma, diabetes, and stuff like that, should they or can they get tummy tuck or liposuction like that done?
See, if first a proper medical evaluation will be done, if there are any risk factors involved, it is not advisable to do it. But if you are fit, I mean, you are all controlled, your diabetes is controlled, your asthma is controlled, your blood pressure is controlled, and we get all the reports are clear. I always
Hmm.
send it to a physician to have it reconfirmed by him. If they confirm that the patient is fit for surgery, then we can do the surgery. However,
Hmm.
a smoker and a diabetic always takes longer to heal.
Oh,
And
yes, I've heard
complications
that about smoker. Yes.
in a smokers and diabetics are always slightly more.
Yeah. And even alcohol, I think.
Not alcohol really, but smoking and diabetes is more. Of course, a chronic drinker, yes.
Hmm. Okay.
Hmm.
He's saying Anant Ambani comes to mind. So
Yes.
I mean, I don't know why hasn't he got anything done for himself? I sometimes wonder. I mean, he has the money, he has the resources. He's not
I'm
done
sure he
anything about
must
his
have. I'm
hair.
sure he must have done. I'm sure he must have done something and might not have worked out. So sometimes a bariatric or
Oh,
something doesn't work or it comes back. I think he's asthmatic and he's taken a
oh,
lot of steroids and all that. That's why he's put on weight.
अरे रे 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 रे. Oh,
I,
अच्छा
I, I,
ऐसा.
I think so. I mean, I'm not anyone to comment because this is what I read in the media, and I don't know what the media half the time always gives bullshit. So you never know.
Yes, you're right. You're absolutely right. So, that's a very good question, Jay. Thanks, because I did not think of this. That do surgeries, these kinds of surgeries, do they interfere with the body's natural aging process?
Oh, it doesn't interfere with anything. It in
Uh-huh.
fact makes you look younger. It doesn't reverse your aging process, however. Suppose I do
Obviously.
a lady who looks like who's 50 years and I do a facelift, she'll probably look 40 years. But she is
Mhm.
still 50. So when she's 60, she'll look like 50. So it's like that.
Oh, you think
Yeah.
I
So
need a
we have
facelift?
I'll have to see you in the consulting room. It's very difficult to tell you.
Okay. That was actually my next question, that when somebody does a facelift,
Hmm.
uh, I mean, how long does that work, or does that come back,
So it
or are there
depends. Yeah,
any
of course you will
precautions
age.
to do,
Of
precautions
course.
afterwards?
Yeah, you will age. It doesn't reverse your aging process. It's not Amrit, but it will make you look younger. As I said, it brings your age down. The look how you have, you'll look younger. That's all.
Right.
And it lasts 5 to 10 years. It lasts.
For 5 to 10 years. Wow, that's
When you
because
are
a
not,
lot of
you have
people.
to understand, as I said again, if I make you look like 40, when if you're 50, so when you become 52, you look like 42. You're not going to look like 40. If you're
Yeah.
55, you're going to look like 45, not 40. You get it? That
Right.
result doesn't last for at 10. You're going to look 10 years and suddenly you look for 50. No, you will age like as if you're aging, but 10 years younger what you would be.
Right.
Get
I
it?
think I will just work on my muscles and go to a gym and get something done.
Hmm.
But after that, I will definitely need a facelift. Honestly speaking, I prefer always natural
Not
ways to do it
exercise
and
is the
to
best
age
way.
gracefully.
Exercise is
Yeah.
the best way, but
Isn't there any
uh,
exercise for the face?
I don't know. There's
For the
so many
face.
face yogas and all that, but I really don't know whether it works.
So that, you don't get wrinkles or
No,
sagging,
not that
this
I
and
know
this.
of. Not that I know of.
Why does everyone, as far as I've seen till date, after a certain age develop this? I hate this.
It's all aging process because of gravity. Everything lataks
हाँ,
hangs down.
तो इसका भी कुछ प्रोसेस होगा फिर इसको ऐसे टक करने का?
Yes, है पीछे से
अच्छा.
खींचते हैं स्किन को. It's called a
यहाँ
neck
पीछे
lift.
से.
पीछे से ताकि स्कार ना दिखे ना, वो हेयरलाइन
हाँ.
में छिप जाता है.
Okay. Then here is the next subject that I want to take up with you. And
Hmm.
the next podcast that we the no, it's the topic is not anti-aging, Sanika. The topic is liposuction, tummy tuck, and weight reduction through surgery, aesthetic cosmetic surgery, and all of that. So that is what we are talking about. So if you have any question, you're welcome to ask. So I think most of the questions we've covered till now. Have I left out anything that you would like to tell us about? Any kind of precautions, or why people should do it or should not do it?
No, one thing everyone should understand, liposuction is not to be used as a shortcut. The best way is dieting and exercise and a healthy lifestyle. That is the best way. There's nothing to beat that. So,
Yeah,
liposuction, bariatric, any other procedures, if you don't have a mindset to have a healthy lifestyle, please don't do that. There's no point in doing it. And
right.
second, liposuction is not a weight reduction procedure, it is a body shaping
Body
procedure.
shaping.
Yes. There are people who, though, they exercise a lot and they don't get six pack abs. Now they come to me and they say, Doc, give me six packs. So I say, okay, fine. I do
Okay.
it. You can do it. It's called high definition liposculpting. Then
Okay.
they continue exercising, and then it is pronounced. They don't want to take anabolic steroids. They don't want to
Hmm.
take fat burners. They don't want to take any of those things,
Yeah,
which
I
are
don't
more
think one
harmful.
should take it.
Which are more harmful. No, people do it. So which are more harmful than the liposuction itself.
Yeah, I
So
agree.
and the risk factor of a liposuction is far less than you crossing any road in Bombay and getting hit by a rickshaw.
Understood. Yeah,
Yes.
you're right. So, yes, that's true that there is no shortcut in life, and the
Yes.
best way out is working out. But like you said, some people they can do everything and anything, and the weight doesn't go down.
Yeah,
So,
then weight again, this is not weight. The fat area doesn't go down. This is not weight. Weight, you will
oh,
not
this
lose
is
any
not weight.
weight with liposuction. No, I've been telling from the beginning. Liposuction is not a weight reduction procedure. It is a body shaping procedure. Weight कम नहीं होने वाला है आपका.
तो
You
फैट
maybe you
में और
lose
वेट
one.
में फर्क क्या है?
So one liter of fat is not equal to 1 kilogram. The density
Oh,
is not the same.
हाँ, then,
So you take out say 4 liters, 5 liters, then you
हाँ,
probably will lose a kilo or two. But this is
oh,
not meant for weight reduction. This is only for body shaping.
understood. Yes, I agree.
Yeah.
But I thought
There are
that,
people. There are people who do weight reduction. It's called mega liposuction. They do
okay,
20 liters of fat and all that whole body. They will liposuck. Come
uh-huh,
on, I mean, I have never done it. The thought of it only scares me because that. Just imagine, I have operated on a guy on his abdomen, chest, arms, back, thigh. How the poor fellow going to sleep? दुखेगा नहीं क्या? पूरा शरीर में दर्द होगा. वो हिलेगा कैसे? डुलेगा
oh,
कैसे? नहाएगा
oh,
कैसे?
yeah,
सब जगह पे सूजन, पूरे बॉडी में सूजन. So I don't know. I somehow am not
oh,
very
and people
convinced.
still do that.
So I don't know
People,
how
I
many
mean
are
to say,
doing. Yeah, yeah. There are people who opt for it. They
yeah,
get they do get fabulous results. There are some fabulous surgeons who do a very good job of it, and they are experts and they do fantastic jobs. But I mean, I'm just giving my opinion that I would not like to do
not
it
do
because
it,
of this.
right?
Yeah.
Okay, this is you can take it as a joke, but
Hmm.
जैसे liposuction से बॉडी का वेट फैट निकाल देते हैं, ऐसे थिक हेड लोगों से दिमाग से उनकी चर्बी नहीं
हाँ,
निकाल सकते ताकि उनको
हाँ,
अकल आ जाए.
है ना, हैमर बोलते हैं उसको. थॉर हैमर, वो लेके मारो सिर पे. ऐसे
But I was
आजकल
thinking,
ऐसे लोग बहुत हैं आजकल.
बहुत ज्यादा,
बहुत ज्यादा
बहुत
ही बढ़
ज्यादा.
गया. I think
हाँ,
God has run out of intelligence to give people, so now the
yeah.
people are born dumb. Seriously,
Is
I.
आई थिंक इज जस्ट दैट सोशल मीडिया ने दुनिया को छोटा कर दिया है और हर तरह के लोग जो
बात यह
पहले
है ना,
इडियट्स
नो,
थे
हाँ,
वो हमारे
people,
सर्कल में या अपने पहुंच में एक दो हुआ करते थे, लेकिन सोशल
हाँ,
मीडिया की वजह से अब सारे वहां पर हैं तो
नहीं अभी नहीं,
सामने आ जाते हैं.
नहीं अभी हमारा पॉपुलेशन बढ़ गया है ना, वी आर 1 ट्रिलियन, 1 बिलियन. तो
यस.
हमारे इडियट्स ही बढ़ गए हैं तो.
एवरीवेयर अराउंड द वर्ल्ड आई एम श्योर.
No, what? Sorry, I mean I was just joking. What I meant
या
to say was what I feel. At least what I feel. These reels and all that stuff. They're very short span. They keep your attention for very short span. It
यस
doesn't allow a man or a woman to analyze and think and use their own common sense as to what has been posted there, because by
या
then something else has come, and then
एल्स
you're
यस
thinking about that. So you have not analyzed that, and you have just believed that, and tomorrow you're blurting it out. Arey, I saw, and on
या
that you're just talking. And I've caught my friend. I said,
या
"ये क्यों बोला तूने?" So no, I've seen. I said, "You saw a reel, or did you see an entire episode?" No, I saw a reel. I said,
या
"Did you analyze?" No, because they don't analyze.
ओह
What they do is, we are seeing a reel, देख लिया, somebody has said something, yeah, Trump ने बोला ये, this, that, and then the next, अभी Trump is an idiot. Okay, but why? Why are you saying he said this?
हाँ
Why has he said this? I mean, you have
हाँ
not analyzed why he said that. You called him an idiot because you don't believe in that. It's just an
या
example. Maybe it is a poor
या
example,
यू आर
but
राइट.
I'm just
No,
trying
but
to
no,
say
no,
that.
no. It's not
Yeah.
a poor example. You're absolutely right. Because a lot of people tend to do that. At times, there are
Yeah.
reels that I have seen about health and a lot. And I have been meaning to make a separate episode on this completely.
We
How
should.
everybody is being mind programmed by seeing these
It
reels
is.
and videos.
And then
And
it keeps
because
on, yes, it keeps on showing the same reels you are seeing every time.
exactly,
Now,
and
you have so many things, कोई फालतू weight reduction pills. अरे ये लेना चाहिए एंड बट वो आदमी है कौन जो बात कर रहा है? उसका
हाँ,
क्रेडेंशियल्स आपने कभी पूछा है क्या? कोई नाम
नहीं
अमेरिकन नाम है? वो कौन
उसके
है वो?
अलावा
I don't even know the
उस
fuck is he?
आई नो
Sorry, I don't
उसके
know who is
अलावा
he.
उसके अलावा एक चीज और हो रही है बिकॉज पीपल आर सो मच इनटू यूट्यूब शॉर्ट्स एंड रील्स एंड वीडियोस एंड ऑल ऑफ दैट negative people are coming up and making these kinds of reels and videos to mind program people उल्टा उनको उल्टा
Correct,
सिखाया जा
correct,
रहा है जानबूझ
correct,
के कि
correct,
तुम ऐसा करो तो ऐसा हो जाएगा अरे ऐसा नहीं
correct.
होता है use your brain. You need to use your brain. This has been on
हाँ,
my mind for the last two
बट
months.
टाइम कहाँ है टू यूज द ब्रेन क्योंकि उसके बाद
Ah,
कुछ किसी और के बारे आई मीन कुछ और सोच रहे हो ना तो वेयर इज द
yeah,
टाइम टू एनालाइज ये रील्स
right.
में एनालिसिस पावर इज गॉन
Gone,
थिंकिंग पावर
gone.
इज गॉन यू हैव बीन
It's
कंट्रोल्ड बाय द रील्स
people are becoming addicted, and people
oh
don't
I know
realize that. People don't realize that. Although
I know how
your
I know how
stories, I
addictive it
love
is.
it.
I also see reels. And I say,
That's what
shit, I
I'm
have to stop.
saying.
I take it and I throw the phone. I'm like, bus ho gaya abhi, sala. Just I
You know,
पता नहीं
no,
लगा
but
20 मिनट चला गया रील्स देखते हुए लाइक व्हाट द हेल
हाँ,
इज इट
20 मिनट, एक घंटा पता नहीं चलता है कहाँ गया. And because of that, social interaction कम हो रहा है.
करेक्ट
So it's been on my mind to make a separate episode, but bus time mile to I will do that. And you're absolutely right. People don't use their brains. People don't have patience and all of that. So anyway, coming to liposuction and tummy tuck, I think we are done with that.
ओके
Sanika, ye question is not for him. He's not a GP that you're 45 plus and you're too tired nowadays. Energy tablets and all ये नहीं. बट हाँ मे बी आज 9 बजे डॉक्टर सुजन के साथ मेरा एक पॉडकास्ट है. यू कैन ज्वाइन दैट एंड यू
So
कैन आस्क
someone,
हर
wait,
दैट.
wait, hold on. There is some guy called Jay. These surgeries
हाँ,
seem to be for the privileged, he has written. You know, my
यस.
friend Jay, that is the biggest mistake you can even, I mean, say. It's not meant for the privileged, it's meant for everyone. And if it, of course, it is not a free surgery, nothing is free. But yes, if you choose a proper surgeon and you choose a proper hospital, you can get it done. It is not that expensive at all. So it's not meant for the privileged at all.
It's for
So
everyone.
yes, it
You
is.
know,
That thing, it is. Oh, it's meant for. It is meant for celebrities. No, majority
no,
of
because
my
it's a
patients are
little
not celebrities.
expensive, no? Because it's a
Yeah,
little
I mean, don't
expensive.
just
That's
say
it.
things because you don't know about it. It is
Yeah.
not meant for that. It is meant for
Okay.
everybody.
It's
I
meant
have
for
operated
everyone.
on I have operated on a vegetable vendor's daughter. She wanted a breast
Oh,
reduction because she had very big breasts. She came to me. She
okay.
knew it was done, and she got it done.
Wow.
Yeah.
Right.
So how is she
Uh,
privileged?
you know, it's irony. 20 years back, when I told you that I had gone to the doctor to speak about my tummy tuck,
Hmm.
reason is I at that time I used to be into acting and all. So I used to
Okay.
do serials and
Yes.
all, and
Yes,
I
yes, I know.
used to be very thin. I used to be like
Hmm.
50 kilos. Today I must be 65. So I saw myself on television one day, and I'm like, oh shit, what the hell? uh this I'm looking sick. I've lost so much of weight, and not that I was doing anything to lose. I was just
Hmm.
plain and simple. I love walking, I love gymming, so that's what I used to do. And I had lost weight. Then I said, no, no, I have to put on weight. And then I stopped gymming, I stopped walking, and I started, although I eat healthy, but I've always been a healthy eater. But then I let myself go a little bit कि ठीक है, अब तो वेट बढ़ाना है. वो वेट बढ़ाना है, और फिर मैंने डॉक्टर को बोला कि अब मैं वेट बढ़ाऊंगी और तब मैं टमी टक के लिए आऊंगी. इसलिए गई थी डॉक्टर के पास. आज तक वो टमी टक तो नहीं हुआ,
Have
बट
you had children, Ginny?
I have two children.
Then you might require a tummy tuck, but
I
otherwise,
have. I
okay,
have. My son is 35 and 30.
okay,
Yeah.
all right.
So they are quite, now I don't need. अब तो मैंने एक्टिंग वैक्टिंग छोड़ दी है तो अब जरूरत नहीं है. उम्र
See,
हो
it is
गई है.
not. People do tummy tucks for making themselves feel better
Yeah.
and looking better in their clothes. And look, when they look at themselves in the mirror, they want to look nice. There are
Yes,
many
I
people
agree
who
with
don't.
you.
There are many people I know who have come and told me, I look at the mirror and I feel like breaking it. I don't like to look at myself in the mirror. There are so
Mm,
many people. You would be
yes.
you will be astonished at how a young girl's body can change after pregnancy, and the body she had before and the body she had after. And I mean, people say, "Arey, you should be natural." Hey, what bullshit are you talking? Be natural. You are.
Yeah.
I mean, look at how you, and because your body is better, you're telling her be natural. I mean, you go to the tailor, you buy new clothes, you put new makeup, and you stand in front of the mirror. Some people don't want to look bad, yeah, they want to
Yeah.
look nice.
Yeah.
It's their
No, but
choice. So why
yeah,
shame them?
I agree,
Yes,
but I never regretted not having it done, because the best
that's
thing
fine.
that happened after I put on weight, that my wrinkled stomach, it
Became
it
better.
came out and level.
Yeah,
So now
okay,
I
that's
can't see
good for you.
my what is that? Those stretch marks and
Right now. So
nothing
great.
there,
So
and
that's
I'm
good for
I'm
you.
okay with it. Yeah.
That's good for you.
I would love to get a flat
I can't
stomach,
show
no
pictures
doubt.
here. As I would have shown you a few, you would have seen what changes people can undergo.
I mean, next podcast when I come to your clinic, you can show us
Yes,
all the pictures that you
yes,
can.
I'll show it.
Yeah,
I'll
all
show it.
right. So Jay, no, the creator has not erred with his creation by creating women or men who feel the need to go under the knife to improve their features. It is just a very personal. In fact, this has been on my mind when I last all month I was in Delhi, and February, I mean this month, and I hardly go out of the house. I hardly step out. Whole day I'm home. I go for my walk. I come back. So when this time I was out, I noticed a lot of things about the generation today and the people today. And it has been on my mind to speak about why people want to do all this makeup, why people want to only look beautiful all the time. Really, is that even humanly possible? It's not. There is a deficiency of self love here, and
Yes,
that
true.
self love
Agreed.
needs to come. Yeah. When you love
Also,
yourself.
also, also acceptance by society, Ginny. You might love yourself, but there are people, you live in a society and then you go, your friends will say, like, okay, let's take a guy with man boobs, okay? A
Yeah,
small young boy,
agreed.
16-year-old, 18. How much have we teased? I myself have teased my friends and I have gone recently and apologized to them, saying, sorry, dude, I really shouldn't have done that to you. We have
Yeah,
gone and
yeah,
pressed their chests and all that. I mean,
yeah.
we don't realize the trauma that the kids undergo now.
Yes.
After, when I'm in this profession, I realized, I'm like, shit, man, I did this for my
Yeah,
friend. I mean, that is
yeah,
so
yeah,
wrong of me. And what
yeah,
once I have done, I think I mentioned this last time. So that people undergo depression, they take
yeah.
pills, they don't go out, they don't remove their shirt when they go for a swim,
Mhm.
and they feel so shy. That when I do it for them, when I change, I do a liposuction of the chest, give them a
Yeah.
flat chest. They are
Gives
happy.
them
They go out.
confidence.
Sure, yes, confidence is another
Yes.
level.
Yes. Yes. I agree with
I've
you.
had a
That does
parent come
come.
and say that his studies also is improved because he
You
feels
know,
nice about himself.
yes, it matters. It does matter. I'll
Yes,
tell you, when
yes.
I decided to give up coloring my hair, I wouldn't feel confident coming on YouTube or recordings. I would feel something missing. It's not that it doesn't matter to me whether my hair is white or brown or blue, but I wouldn't feel confident. Then I told a friend of mine, and he's like, why you not coloring it? I said, because I don't want to use chemicals in my hair,
Mm,
and I want to age gracefully. I want to love myself that way. So he's like, okay, but go slow with it, and if you think that it's affecting your confidence, then do something
mm,
about it. Fine, I started using indigo. I don't want to use color. I still don't use color. I have not used color since quite a few months. I'm
mm.
using indigo. I used mehendi. I used indigo. I'm okay if it, slowly the color goes away. That's all right. But I mean, my hair is so long that the entire thing to become white will take years. So it's okay. If there was no body shaming at work, would anyone think of tummy tuck or liposuction? So, Jay, I feel this
Okay,
is
one second. Let me answer him.
sure.
Now, I have recently I operated on a lady whose stomach was post pregnancy was hanging up to her mid thigh. When she sits in the
Ah,
toilet, yeah, when she sits in the toilet, her stomach goes into the toilet. Now tell me, wouldn't she
oh,
want a tummy tuck? I have
100%
another.
she would.
I have another lady. No, I have another lady. This her breasts are hanging up to her waist or up to her umbilicus, a belly button, and she is only 38 years old. Wouldn't she
Shit.
want a breast lift and a reduction?
Yeah, she
Isn't it?
would. I would. Yeah.
Yeah,
That's
I mean,
inconvenient.
there. I know. I remember. I operated on a lady who was 84. She didn't know a tummy tuck could be done. Her tummy was so big when she used to lie on the side of her bed, the stomach used to fall down off the bed and she used to fall off the bed.
Huh?
Yes, it was 18
Yeah,
kilos. 18 kilos of fat hanging down there and skin. I took it
yeah,
out and she was so happy.
yeah. These
She
these
said,
are
this is
extreme
the best thing
cases,
I've
of
ever
course,
done. No, no, many people are not happy. Now,
and they are
you
not
go out
happy.
with your friends, you have the little bulge over there, and you're wearing track pants, you're trying to exercise, but you want to wear those clothes. So it is your wish if
Yes.
you want to wear. Who are
Yeah.
we to judge that what you want to wear? You wear what you
Exactly.
want. But if I don't want and I
Exactly.
want to change my body, I'll change it.
Yeah, everybody has their
Yes.
free will to do what they
Yes.
have to do, what they feel is best for them. I totally agree with you.
Yeah.
I mean, if
Body
I,
shaming as such is a bad thing. You should not sit and body shame someone. But I have
yes.
gone up, my friends have gone up and told another friend, look, you're wearing these clothes is not looking nice on you. It's
Oh,
looking bad.
yes.
Get something
Yes.
done. Because some people
Yes.
they come, a guy will wear his pant half hanging with his butt being seen. I mean,
Yes.
don't walk like this,
Don't
man.
do that.
No,
Don't do
but
that.
my pant, I can't put my pant up because my tummy. Get something done to your tummy then. At least कपड़े तो पहन ढंग का.
This I agree with you that a lot of people they want to wear the clothes because they see people on screen wearing those
Yes.
clothes and all, and but then their body doesn't look good in that,
It looks
and they
horrible.
don't understand. They don't
Yeah.
understand, and they just want to go wear it. But I
You
mean,
know,
come
there are so
on.
many people say, "Oh, you must respect it." All those people who say you must respect it, fine, you respect them. But in your mind, you would have also passed a comment that, "Oh man, she's
Yeah.
looking so bad." You don't want to.
Yes.
You want to show. It's 100% anyone who's saying that they have not done it, they're lying.
You know
Totally.
what, this happened just 4 days 4 5 days back. I went to a place, I don't want to name the place. I went to a place and the manager there, some new guy, he's like huge, 6'2" or something, and he is with his stomach bulging and muscles
Horrible.
bulging and everything, and he's wearing this tight pink t-shirt, full sleeve, with all kinds of studded glitter and studs on it. And
I think I
I,
know
you
what you're
know,
talking about.
I'm looking at this person for like next 15 minutes and in my mind what's going on. Why is he wearing like this? Is he gay? Why is he wearing such tight clothes? Is he out for attention? And then I'm telling myself, no, Ginny, you're judging him. That's his choice, his free will. So what if he wants to wear it? It's his choice. Why can't you
Yeah,
just
yeah,
accept
wear
it?
it.
I
Wear
mean,
it.
and
We
then
won't look at you, that's all.
yes, but the thought did come to my mind,
Of
right?
course, of
That
course
it's
it
not
came.
looking good. If he has to wear those clothes, let him do something about his tummy. But that's his life. Who am I to, judge him or tell him or even think about it? So I corrected
Exactly.
myself there that no, I have to correct my thinking. So I did that there. But then
Well, just,
this,
just
yes, you're right.
no,
Dimag mein
see,
aata hai.
I do not think there's anything wrong you thought about. I mean, it doesn't look good. It doesn't look good. You don't like the look. You don't like the look. You don't need to like what somebody else likes. Correct?
Yes, yeah.
Yes, but you didn't go and make fun of him. That's okay.
No, 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 no,
Yeah, I
no.
mean,
I
you didn't
can't.
like it. I don't like the way you look, man. Finished. I mean, it's my choice.
Yeah,
You like the way you look. Good. You're happy. Be happy, man. That's your
exactly.
choice.
Yeah,
Yeah.
and the girl that was there, I asked her, I said, does he always dress like this? She's saying, oh, today he is very sober. Generally, he is very bold and worse. I said, "Oh my God, thank God I came today."
Yeah.
Is body shaming gender biased?
Body
Jay
shaming can
has an
happen to anybody.
yeah. It
Yeah,
can happen.
anyone can do anything. So it's
Oh,
not
this
gender.
this this question brings another question to my mind. Are there any a man turning into a woman or a woman turning into a man? Does that also come under what you do?
Yeah, but that's a
Gender
total different.
change?
Yeah, but that's a total different chapter altogether.
No, no, that's all right. That it's a
I,
chapter,
I,
but
I don't do it. I don't do it, but some of my colleagues do it. It's called
uh-huh.
gender reass. I don't do it. Some of my other colleagues do it. It's called gender reassignment surgeries. I have done a
Okay,
few. I somehow just don't. I don't have the taste to do it, so I don't do it. I don't like to do
okay,
it.
but people still do it. All
There
right,
are people who do it. There are people who are men who are in women's bodies, and there are women who are in men's bodies.
men's
It is a
bodies.
known fact. It has been proven scientifically. So it is
Mhm.
just so unfortunate that they are like that. I feel really sad for them. But I do not
Yeah.
know. I don't. I have not taken interest in that field of doing surgeries. There are some fantastic clinics in, I think, in Indore, and majority of that happens in Thailand. But
Oh,
gender reassignment surgeries, yes.
okay, okay. And uh, is liposuction or enlargement or reduction also done on
Men.
uh, no, men or women genitals parts or
So,
also?
yeah, you can do. So, men, you can increase. There are procedures which you can increase the length and the thickness by putting in fat
Oh,
and releasing a tendon. You can increase the length to some extent.
okay.
And in women, so the women is a usually the labia is called gender aesthetic surgeries or cosmetic
Okay.
surgeries genitalia. So you can
Uh-huh.
put in labia majora, you can put in fat and make it look more younger. The labia minora can be trimmed. Sometimes it's very large. You need to trim
Oh,
it. You can tighten the vagina. You can do so many things. Those are all fine.
oh,
That's done on a regular
that's
basis.
oh, oh, is
That's
it?
regular. So
Wow.
every time I do a tummy tuck and all that, I the mons pubis and all that, I shape it up so that tomorrow when they got a flat tummy, so when they wear track pants, it should look nice. No, it should be in harmony. It cannot
Yeah,
have a
yeah.
certain lump in between. So all
Right,
that is
right.
done. Yeah, that's all done. That's all normally done.
Fantastic. Wow. I hope to see you soon. And maybe
Sure.
whenever you have the
The
time,
pleasure
our
is
next
mine.
podcast, we will think of another subject since you said that this gender
Reassignment.
reassignment, you don't do. So maybe you can put me on to somebody who does that and if
Yes.
he is willing to. But then I do
Sure.
have another subject for you, which is hair.
Okay.
And
Sure.
yeah, so we'll meet you soon. Thank you so
Sure.
much for
Most
giving me your
welcome.
time.
Thank you for
Always
having
a
me over
pleasure.
today.
Always a
Sorry about all the
pleasure.
confusion today. It was
Not at
my
all. It's
crazy
all
day.
right.
All right.
It's okay. Happens.
Thank you.
Bye. Bye. Goodbye.
Bye bye. Bye. Goodbye.
Bye.
Bye.
Bye. Thank you, everyone on YouTube, for watching, joining, and if there is any other subject that you want me to take up with Dr. Amod, please write it on my under this video so that we can take it up. Thank you so much. Goodbye. See you at 9 with Dr. Susan. Bye.